I wanted to talk a little bit about some of the logistics that address the issues of equity. As everybody knows, Montgomery County is a jurisdiction that is majority people of color, and we also have a lot of issues around poverty as well. And so specifically, how is the state's GOVAX program coordinating with our local health departments and municipal governments? Since we, at least here in Montgomery County, have a pretty strong understanding of the disadvantaged residents and communities. Locally, we have set up structures such as our Por Nuestra Salud y Bienestar, which is a Latino COVID-19 health initiative. Our African American Health Program Executive Committee has also established an initiative. We have reactivated our census teams, community service hubs that we have funded, and also we have been able to leverage. And we also have partnerships with our faith community. In other words, we have a very strong network that has been stood up specifically to address issues of equity and language, cultural barriers. Unfortunately, we have received a lot of feedback around, for example, the PrepMod process, which has had incorrect Spanish language translation, which leads to basically a complete barrier, because even though the state might think that this is appropriate and that it's being translated and that folks are able to access it, the specific examples have shown that the translation is absolutely incorrect. Certain terms do not mean anything with regards to understanding this process. So this is a real concern. We have also noted the governor has created the Maryland Vaccine Equity Task Force, led by General Janine L. Brickhead as part of the GOVAX effort. Who are the other members of the task force? What is the mission? What authority do they have in terms of decision-making process for the vaccination plan? And how can we bring up these issues to them? Will there be written updates? Will there be data that specifically disaggregates, race, ethnicity, age, place of residence, et cetera, so that we also locally can track how we're doing? How can we best integrate our best practices locally with the efforts at the state level?
So thank you, Councilwoman Navarro. I'd like to first address the PrepMod question. I'd like to turn over to my colleague, Dr. Mark Martin, who has been very intimately involved with me and with our GOVAX team and also with the Equity Task Force. So with the PrepMod, we are working with the PrepMod vendor, Maryland Partnership for Prevention, as well as our local health departments, and getting that feedback is critical. So we appreciate that. And so the translation issues being resolved now, and some of the other high priority concerns that have been raised with PrepMod also are being addressed this week. And so those enhancements are underway. So just wanted to share that with you. And so any issues that impact access or understandability, we do want to know about. So, and I'd like to turn over to Dr. Martin to address your other questions.
Thank you, Dr. Chan, and thank you for the question. So relating to the GOVAX campaign, when the campaign was under development, we were taking great care to ensure that it would be, in terms of messaging content, culturally appropriate and culturally sensitive. So we established a community outreach planning work group that actually started out with about 35 members and has grown organically to over 100 now, to basically look at the content messaging, also to give input on the strategy for the GOVAX campaign. And so the campaign launched, I think, 2 Fridays ago. The group in general agreed with it's headed in the right direction in terms of cultural reach and appropriateness. And so we continue now to meet as a group. The group consists actually of community-based organizations or representation, faith-based organizations representation. There's some interagency and local health department interaction and representation, and academia. And so we now meet weekly to see how we might open up additional channels for the GOVAX messaging to get to the very grassroots levels of our communities. And so some of the strategies that we've been looking at in terms of opening these additional channels for the messaging, as well as potential temporary vaccination community outreach sites. We've actually been looking at mobile units, clinical mobile screening units, repurposing those as mobile vaccination units. We've been in discussions about that. And also we're looking at outreach through public gathering spaces, laundromats, transit stops, retail establishments. The idea there is to have mini webinars that can be accessed by QR code or live web link for a 5-minute video that promotes participation in vaccination efforts, that actually starts to put some truth out on the street because of the vaccine hesitancy. There's a lot of rumors going around. With looking to engage with Black and Brown clinicians for these webinars. We continue to distribute information sheets and flyers, these COVID-19 related information sheets and flyers that promote participation in our mass vaccination efforts, as well as the ongoing best practices of the physical distancing, wearing the mask, frequent washing of hands. We've also been in conversations with historically Black colleges and universities, HBCUs, to see how we can support them to help promote COVID-19 vaccinations, communications, and messaging to students and faculty and staff. We've also employed the use of a sound truck, a mobile public health education unit that is a converted flatbed truck that has the ability to broadcast multilingual audio messaging. What we typically do is have a partner where we're sending this truck down a certain route. We get feedback from the community of the best places to go with the truck. And we typically partner with some organization in terms of volunteer support so that we can distribute free masks and also information sheets. We actually ran the truck back in October in zip code 21224, where we gave out an average of 3,000 free masks as well as about 3,000 information sheets. So we continue to work through these strategies and develop them. The Equity Task Force is now being established, and we continue to work with Brigadier General Burkhead. One of the first things that we're working on right now, and we had actually begun discussions in our community outreach planning work group, was partnering with houses of worship, churches, and the ways that they might be able to increase the vaccination participation in the communities that they serve. So right now, we're developing a pilot with as a part of the Equity Task Force to stand up a vaccination, two temporary vaccination sites to work out the kinks. And then the goal is to scale those efforts. And I'll stop there.
Thank you so much. I just want to add that, Montgomery County in 2019 adopted a legislation, a racial equity and social justice legislation. So we luckily have a head start on a lot of these issues. And under the leadership of Dr. Kroll, Dr. Gales, and really the entire council and the executive, we're really ahead in terms of addressing these issues of equity and culturally appropriate ways of getting to our community, so that when the pandemic hit, we stood up these structures, first in terms of testing and public education, but we quickly were able to expand those structures and those approaches to the vaccine. I want to give a couple of examples of what the Pret Mod actually included in the Spanish language version. In the option of race, for you to indicate your race, it was translated as carrera. Carrera is like a race car, a race, right? Track, right? In terms of your address, it said hablar, which is like to address a an audience, right? To give an address. Instead of saying in the backside, it said espalda, which is a body part. And I share that because we know the research is clear that our Black and Brown communities are disproportionately affected by this pandemic. and that there is a lot of fear in terms of what is out there as rumors regarding access to the vaccine. So you can just imagine that if we all do all this work that you were just describing, and when people get to the step of registering, it's asking for a carrera, a race, a cart race. People are obviously going to give up. So this is not acceptable. And I respectfully request that Montgomery County have a representative in your committee and your efforts, because again, we are the largest jurisdiction and we mirror not only the country's demographics, but also the global demographic. As I stated earlier, we are a majority jurisdiction as majority of color, and we have over 100 languages spoken in our school system. And at the end of the day, equity is about really getting ahead of this virus, because if we don't address this issue in an equitable fashion, the entire county suffers, the entire state suffers, the entire region. And in order for us to be able to move ahead, we have to address this public health emergency. Our economic recovery is tied to this. So I cannot be more forceful about the notion that we are here suffering because the disconnect that has been really in place in terms of our ability to access state decision-making and input, et cetera, has really hindered our work. And so I respectfully request that we work together and that you please prioritize Montgomery County. Again, especially with these mass vaccination sites, et cetera. It's illogical not to have something like this in the largest jurisdiction in the state. So thank you so much for being here. And I really look forward to seeing some improvements in how we address the issues of our residents who happen to be the majority here in Montgomery County. Thank you.